Well, thanks to each of you for taking the time to be there today, and especially to the dean for scheduling this with us. So when we were originally looking at the topics that we could address over the course of this week, and thanks to Dr. Dull for organizing everything, because it's actually been really a lot of fun, and we've gotten some great feedback from faculty. But when we started talking about chronic conditions, and you start looking at the talents across our schools, Dean Wysocki, this was the perfect opportunity for us to engage with her based on her background, and of course her leadership position. And so I'm a little scripted and I'm not a little scripted. I want to say she is such a pleasure to work with. She was such a great recruit for UB. To come here and be leading in the school that she's situated in. She has a great background in not only higher education institutions, but for those of you that are unfamiliar, she spent some time at NIH. And I say that with a smile because when we were just working with her and her team to submit something to NIH, a P20 that we were all sort of, everybody's going to start shaking on the screen when I say P20, a couple of weeks ago. She was a tremendous resource and she was very much part of helping us get things over the finish line. Another good thing to mention, and I think something that was exciting for all of us to see, and if you're unfamiliar, is that she actually also advocated very heavily and was able to champion and secure a new nursing simulation center for her school. Which I'm not sure if Dean, you're going to mention it in your talk, but it's pretty impressive and pretty cool stuff. So she's a wonderful researcher, an amazing administrator, a tremendous leader, and we're just very fortunate and appreciative that you're willing to take the time to do this with us today. So that said, thank you for kicking off the topic.
Thank you. It's great to be here. And thank you for all those wonderful comments. I'm not sure I deserve them all, but I'll take them when I can get them these days. So just want to welcome everyone here because, of course, chronic conditions are something that nurses deal with a lot, and especially as part of visiting nurse visits, we deal with those chronic conditions for people where nurses come into the home, for people that are discharged. So it's sometimes issues that arise due to a transition from a hospital or an acute care setting into the home setting that create issues sometimes that aren't well planned and thought ahead of time. As we've driven down the length of stay, then it's made some of those transitions actually a little more difficult, and then without the proper at-home support. So many of you probably know that chronic conditions really account for about 90% of our healthcare expenditure budget. So that's out of a $4.5 trillion budget in healthcare. About 90% of those are due to these chronic diseases. And of course, you can think about the usual cast of characters: heart disease, cancer, diabetes, hypertension, stroke, COPD, dementia, cognitive decline, Alzheimer's. And then, of course, for me, because I'm a wound healing researcher and have conducted, basic science studies with, making artificial dermis in the lab, then actually one of the top 5 reasons for home care visit is for wound care. So that's always captured my attention because I've cared for a lot of people with various types of wounds and had a background in burn units when I first started my career. So we know that right now about 6 out of 10 Americans have at least one chronic condition. We know that another 42% have 2 or more chronic conditions. And a lot of these chronic conditions are actually, when we think about it, there are a lot of modifiable risk factors. So there's a lot of emphasis now on behavioral help. And I see that we have somebody here that's going to be probably talking about motivational interviewing, but it's also a part of a strategy to help people. So we know a lot of the reasons what these chronic conditions are. We know some of the behaviors that people need to adopt or engage in to change that behavior that then can modify some of the risk of these chronic conditions occurring. So some of these things, like I feel like we've done a pretty good job in some places of trying to drive down cigarette smoking in the US. I'm a really old dog, and I remember being on airplanes when there was a smoking section. And we don't have smoking on planes anymore. So we certainly have moved a lot in terms of our society about creating rules to decrease risk factors for people that don't smoke. And But then some of it's, things like alcohol use, exercise. Some of us just aren't getting enough exercise. We're no longer a very rural country. We have a lot of manufacturing, desk type jobs, intellectual jobs. So some of us aren't getting the level of exercise we need. And then nutrition is also an important part of that. Many of you are probably familiar with a lot of maps where you can look at stroke, what they consider, especially in the southeastern, the stroke belt. And some of those risk factors have to do with obesity and hypertension in those areas, which have a higher prevalence. So I think, as you know, in trying to pursue types of research and research agendas to address, not only maybe preventing, but trying to affect some of the modifiable risk that people have. I think overall, my take on some of this too is we need to be starting at ever increasing with our youth, not just with adults who sometimes then are, when we think about that, um, the accumulation of all of these health behaviors then can result in those conditions that then manifest themselves in their 30s, 40s, 50s, 60s, and above. But I think it's making sure that we're starting and engaging with our youth is becoming increasingly important to try to have an effect, and especially as obesity rates nationally have increased so dramatically, if you look at obesity maps over time. So I hope that today some of the discussion that people will have and engage with will help people find some connections with other researchers across campus. I know here in the School of Nursing, we do have Dr. Carliera Weiss, who's doing research on cognitive decline and Alzheimer's disease. We have people looking at transitions of care, which is Dr. Sharon Huner's work. We have people looking at sleep and sleep in cancer survivors. We have also people looking at stress and healthcare, people that provide healthcare for those that have chronic conditions and the stress that manifests. And so Yuping has done a lot of work in that area about trying to help people who are caring for the caregivers for caring for people with these chronic conditions, and especially if they're being cared for in the home. And that can be quite a stressful situation. So I do hope we do have people here looking at climate change and its effects on chronic kidney disease. So there's so many things that, again, are part of things that you might think about what can we change to make it better to try to at least prevent some of these conditions that then occur later in life. So with that, I'm going to turn it over to our next speaker.
Thank you so much, Jean Wysocki. We'll start with our 1-minute pitches. And I'm just going to go across my screen. So Linda Ramsey, you are up first. Did you want to talk about your work?
I thank you very much for having me. I signed up last minute this morning, as you know, just because of the topic for chronic diseases, chronic conditions. I don't have a pitch planned. I'm not a researcher. I'm on the patient side. So I've led support groups for over 15 years, maybe 17 years now, for people with chronic conditions. And unlike Dr. Wysocki was discussing, all of my, I want to say all of my members, can't call them patients of a support group, but members of the groups throughout the years, they're not conditions based on accumulation of health behaviors or strokes. They are all genetic disorders. So for decades, I've worked with mitochondrial disease research, mitochondrial disease function, and then all of the symptoms that come from mitochondrial disease and the specific mitochondrial disorders within that spectrum or that umbrella, as well as cancer, as well as dysautonomia. So most of the chronic conditions that all of my clients have worked with, dealt with, and all the support that we provide has been more of not through health behaviors. So, like I said, I'm here to glean information from you all, the experts in the field. I'm always trying to see what is the new research out there, where are you headed, what are you looking at. If I can help from the patient perspective, like I said, I've really 30 years from the patient perspective and then directly, with the support groups almost 17 years now. So thank you very much for having me. That's my little pitch. If I can help out in any way, I'm happy to.
Perfect. Thank you so much. Up next, Dr. Oldani.
Uh, Hi, everyone. I participated earlier in the week. I'm here more as an observer. I'm a medical anthropologist. I'm also the director of IPE, interprofessional ed and practice in our training programs. We deal a lot with chronic disorders, so I'm always curious of what people are interested in researching here at UB. And my own research is kind of focused on the pharmaceutical industry and the cost of medications for chronic disorders, sometimes the overprescribing. Dean Wysocki brought up obesity, and the GLP-1s are sort of overrunning the market in interesting ways. And on one hand, they seem like a panacea for so much, but in other ways, they're expensive and they're become political and cultural. So I'm curious about that intersection of prescribing and chronic disease, cost, and of course, it's nice to meet you, Linda. Kind of patient-centered approaches to managing that from a team-based point of view. So thank you.
Thank you, Dr. Oldani. And then Dr. Blitzstein.
Hi, everyone. I don't have a, speech or a pitch prepared, but I'm at the Jacobs School of Medicine and Department of Neurology. I do a lot of research on chronic illness such as dysautonomia, long COVID, and genetic disorders. So hi, Linda, and thank you for your work. I've had a long relationship with University at Buffalo. I was undergraduate. I was in the honors program. I did research as an undergraduate. I received a small research summer grant, and I went to medical school at UB. So my career evolved from being a research assistant to being a PI now on chronic illness. I am a practicing neurologist. I see patients with chronic neurologic, autonomic, post-infectious conditions, and I do research. My research assistants are mostly medical students, some undergraduate students from honors college, where I come from, and we're always short staff. We're always looking for support. We're always looking for graphic designers, statisticians, people who can help us make tables, because we are run on volunteers. And, it's very hard because I'm busy, the med students are busy. So we cram a lot of great research, nationally recognized, award-winning research. My students are presenting at the annual meetings at the American Academy of Neurology. They're winning awards at international and national conferences. But I'm here to see how can my university that I've been with for, I kid you not, nearly 30 years in some capacity, how can they support me and my students and my research team so that we could do better things? And I am open for any ideas, collaborations, small research grants, students grants, everything. I am in on it. Thank you.
Thank you. No, we don't have anyone else on who signed up. So if anyone would like to pitch and they did not sign up, now is the time.
I'll do one quick. So my name is Kyle. I'm with emergency medicine. And my area of research for my own stuff is usually on low back pain and other musculoskeletal pains. So we just did a few decent sized grants in the past year. We just submitted a small R grant with one of my colleagues at another institution. But I'm kind of open for the next phase. I'm not sure exactly what that is yet. So we're kind of building that, but if anybody's interested in low back pain or other types of musculoskeletal pain, either chronic or acute, we do the acute side as well. I'm happy to link with you. My specific point of interest is the point of discharge from the ED. So at that point, there is a couple of main paths people go down. One is often into rehabilitation, whether it's PT or other rehabilitation forms there. But many people get lost there either due to financial issues, transportation issues, other socioeconomic issues, or sometimes they just start to feel better. Sometimes there are other occupational limitations, but that's the specific point that I really am interested in. But we kind of work in the spectrum, and I have a group of individuals I work with on campus and off campus, spanning over to rehabilitation sciences, and we include some sports medicine docs and others as well. So that's my pitch if anyone's interested.
Thank you. Would anyone else like a turn?
Sure, I'll just
Okay.
speak up a little bit. I'm with the UB Motivational Interviewing Center, which is a training center for motivational interviewing. But I'm a researcher in the Department of Psychiatry, and I've done research on health behavior change for my entire career, and I've been at UB my entire career. In listening to discussion about chronic conditions, some of them are sort of resulting from behavior issues, some of them are genetic, but my guess is that pretty much all chronic conditions benefit from healthy conversations with patients, especially around changes that they can make to manage their conditions. And so, if anybody's interested in sort of talking about how those conversations can be most effective, that's the area that I'm focused on.
Thank you. Anyone else? If not, Jill, do you want to go over the breakout room structure?
I sure can. Before I do that, I wanted to pitch back to Dean Wysocki to see if she had any comments before we break everybody into rooms.
No, I just think that everybody has made some great, doing some different types of work here. That's great. And Linda, I was interested because I was at NIH when we were sequencing the human genome and on that march. And so Francis Collins was a sort of colleague there. And of course, he was a very big on, looking, and thinking about, his view of the world, which is it's either genetics, infectious, or it's, traumatic, and just kind of dividing the world up in that way. So I think that that's a big component. And then as I've been listening to it, takes me back, and I have to say I haven't read the book, but it's on my reading list about the body keeps the score. And I think that's another thought as we think about the accumulation of some of these risk factors that might be inherent, but then what can we do to change things? And then listening to Kyle, I'm sort of interested because actually he may or may not be aware that the number one occupational injury for among nurses is low back pain and back injuries as we're trying to lift and move patients. And sometimes because we don't have sufficient help, or, and especially as our patients have gained in girth, sometimes as we're trying to move them. And I'm a 5'3" nurse, and I remember having to get up on beds and gurneys to try to get people moved over from an OR bed back into a bed and that kind of thing. So all of these topics that people have talked about, and even thinking about, some of the, again, Alzheimer's disease, dementia, some of the other things that put people at risk, traumatic brain injuries, those types of things that then can cause a lot of chronic conditions. And again, I think trying to work together and develop ways to test out new solutions to see how we can improve outcomes for patients is incredibly important, and or at least support them along the way, which it sounds like Linda is doing in her group. So it sounds like we have a lot of really interesting topics here to discuss. And so I think it's great to have you all here with us today. Thank you.
Thank you, Dean Wysocki. So the way that we have things organized is I'm gonna launch and open 3 different rooms so that you can come and go from any of them as you choose. So we have one that's focused on clinical research, another on basic research, and then a third that allows people to come together to speak about community engagement and programming, because obviously that's something that UB does extremely well and also is an essential part of what happens here on campus. When I open the rooms, the only thing that I've suggested to the teams that we've met with, or the individuals that we've met with over the course of the week, is, think about, if you want to stimulate conversation, about an RFP that you've seen recently that would take an interdisciplinary perspective to approach it from. Put something like that out there. think about if you find a common element that you would like to explore about a way that we could write something up that would either create a new center or an institute within the university. I can help with the mechanisms of that. That's done through the Office of the Vice President for Research, but we know how to go about that process. Or at the same time, I can also say, also think about if you want to get something started, what you might need from a seed funding perspective, because that's also something that I can help with to try and advocate either through the VPHS or the VPRED or other different mechanisms. Because I think sometimes we always say, let's get people together and get them talking. But you need sometimes the resources in order to get something going, to do data collection or whatever, to start something going, to go after external resources. So with that said, I'm going to open the rooms. We'll call you back probably around 12:45, 12:50. We ask that when you come back, I have a survey that I'm going to run for you. And the purpose behind the survey is not really to talk about the program itself, but to ask you if you want to be engaged in further conversations with the group that's here, so that our office can help facilitate the next meeting. We don't want to basically bring everybody together and say, this was a lot of fun, without supporting you to bring everybody together again. That's the administrative burden or the administrative opportunity is with our team, not burden. So that's the purpose behind it. And we'll ask some questions in the survey. So thanks for everybody for joining, and especially Dean Wysocki. Dean Wysocki, I don't know if you have to roll off because of your schedule, but I was guessing you might have to. So
Yeah.
okay. Yeah, perfect. All right. Thank you again.
No, thank you.
So you should be able to pick your breakout room down at the bottom of your Zoom toolbar. It might be in the three dots that say more.
And if you can't find it, I can send you to one if you tell me where you want to go. Just wanted to thank all of you again on behalf of our office, especially thanks to Dr. Dahl for the organization of this past week. I know that a couple of people have joined the conversation for a number of different topics. We hope if you can take a minute or two to answer the poll. If it didn't pop up on your screen, then there's a button on the bottom right-hand side of the ribbon where you can click polls and quizzes, and it should be there. It's just going to allow us to support you best in moving the conversation forward. There's only so much that can happen over the course of 25 minutes, and we recognize that. So you'll be hearing from me probably in the next hour, because I'm going to connect all of us via a colleague in the dean's office, Linda Cristiano, to set up a follow-up meeting for anybody that would like to engage, and where we're going to get that information as to who would like to engage is via the poll. We do have the opportunity, though, to extend the invitation further. So if you can think of a colleague who wasn't able to attend today, or somebody that's part of your team that should be engaged in the conversation, just send us a name and an email, and we will be sure to loop them in. Dr. Dolph, anything before we log off?
No, just thank you all for coming. I know a couple of people were on different sessions this week. I hope it was a fruitful week and that great things come of it. So thank you so much.